Coming up next on The Voice of Alabama Politics, our special guest is Public Health Officer Dr. Scott Harris. Also, the V-Team takes a look at a damning report about abuse in Alabama's prisons. And is there a plan to open schools safely?
Aren't you forgetting something?
Nah, just a crapshoot. All this and much, much more coming up next on The V. Welcome to The Voice of Alabama Politics, where we tackle the tough issues so you have the hard facts. I'm your host, Bill Britt, and I'm joined today by Susan Britt, my constant companion.
Just us today.
Yeah, just the two of us. We can make it if we try,
yes,
as the
we
old song
can.
says, right?
Right.
Susan, we this past week, the Department of Justice released another disturbing report on Alabama's prisons, in which they said that the officers at the prison, some of them were using excessive force.
That's an understatement.
Excessive force that the Department of Justice believes violates the 8th Amendment, which is the amendment that says that we do not inflict cruel and unusual punishment on prisoners. They said it's a systematic problem. They also said that there is systematic cover-ups. They're underreporting these events. They are not reporting these events. And there are just some horrific allegations in these reports.
We've been watching as Eddie Burkhalter, one of the reporters for APR, has been following a lot of this violence that's been going on. And some of these stories are just awful. There's one where a prisoner was in the infirmary, and the prison guard was beating him and telling him, my name is death. What is my name? Tell me my name. Witnessed by a bunch of nurses. Yeah. Another instance where an inmate fell out of bed.
Right.
But he ended up with multiple contusions, black eyes, and a broken nose. And a lot of the ones that we've been watching, and one of the ones that was most horrific to me was there was, quote, a mob of correction officers that were beating on this one man. A sergeant tried to get involved and break it up. They sprayed him with pepper spray, pushed him out of the way so they can continue to kick this guy and beat him with batons. I mean, this is just awful stuff.
And the thing is, for years, actually for decades, maybe centuries, Alabama has been a lock them up and throw away the key type of state. We understand that.
Of course.
We are people that believe in law and order and tough on crime. But as we've said year after year after years, we have to learn to be smart on crime. Just because a person is incarcerated doesn't mean you can beat them, that you can starve them, that you can ignore their health, mental health. Now, the federal government, came in 2 years ago and said that the prisons were in terrible shape and that we needed to get the overcrowding down. We need to work on the mental health issues and all that, and nothing substantial has been done.
They've not even hired, they're required to hire X amount of COs. They've not done that. And I understand it's hard to hire them because nobody wants to work in these conditions. You're basically in prison yourself 8 to 10 hours a day.
Right.
But if we don't do something, the federal government is going to come in and take over the prisons, and it will bankrupt the state.
Well, and because the federal government has threatened it so many times, it's sort of like the boy who cried wolf. People just don't believe that they're going to do it. I mean, there are lawmakers who'll tell you flat out, they're never going to do this. But we get report after report, and I think we have to finally say to ourselves, this comes down to leadership.
It does. It absolutely does.
If there are rotten correctional officers, it's because somebody ahead of them is letting this go, and somebody ahead of them is letting this go.
Well, also found in this report was not only the violence, but also the cover-ups in the reporting, and the one correctional officer in the infirmary threatened the nurses.
Yeah.
And so it's also a huge cover-up going here. And that comes down to leadership, whether it's the leadership at the warden level or at the top of the ADOC.
Yeah. Excuse me, I choked on my own breath. That's weird. But really, we as a state and a nation cannot treat people like subhumans. Once they enter the system, they are in our custodial care. We have a responsibility to take care of them.
Mm-hmm, we do.
I think you and I have proven through our reporting over the years that we are very law enforcement friendly.
Yes.
We believe in the job that they have to do, but we also believe in basic fairness, and that police officers and those in law enforcement should not be able to go above the law or beyond the law.
Exactly.
As they see fit. We all have to play or should play by the rules. And this is what brings me back to Huntsville Police Chief Mark McMurray. Said after the June 1st and 3rd, 2nd.
Correct.
Is it 3rd?
I think it's 2nd and 3rd, or
Okay.
1st and 3rd. It's one of
First
them.
and 3rd, 1st and 2nd, whatever it was. The June protest, Black Lives Matter protest, there was a group that stayed around later. They protested. McMurray allowed his officers to pepper spray them, to tear gas them, to shoot them with some type of rubber bullet or pellets, and
the beanbags.
And the beanbags, right? And so when he was trying to justify these acts, he said that it was Antifa, the anti-fascist group, or outside agitators.
Right.
And one of the things he did to prove that it was Antifa, Susan, was he showed a picture of Benjamin Shapiro,
Right.
a man who lives in Huntsville, and said that he was a Antifa sympathizer.
He did. Ben Shapiro was not even at the protest. He
Right.
wasn't even a proponent of the protest. This just happened to be something, again, that they grabbed off social media to try to prove their point.
There had been some vandalism at synagogues in Huntsville and the area, and Benjamin Shapiro, went on Facebook or the internet to try to find a picture that was used by Nazi resistance.
Right.
And he found this emblem.
Right.
He posted it on his Facebook, not knowing that Antifa had co-opted that thing. Now, that symbol. Now, Mr. Shapiro has spoken out. He is now, as he says, the reluctant face of someone calling on police reform. He's not calling to defund the police. He's calling on the police to stay within the parameters that they should. No city like Huntsville should be gassing their citizens.
Absolutely not. That was ridiculous.
Yeah. And still, nobody's paid the price.
No.
All right. You're watching the voice of Alabama politics. We'll be right back. Dr. Scott Harris is our guest.
What's up, Alabama? It's Bo Jackson. Do I really need to say it?
you doing today, babe?
I thought I'd head down to the lake with the guys, do a little fishing. Of course, none of us will be wearing our seatbelts. I'll lose control of the truck, wrap it around a tree, and kill us all.
Okay.
Drive safe, Alabama. A message from your Alabama Department of Transportation.
Welcome back to the voice of Alabama politics. Our special guest today is Dr. Scott Harris, Public Health Officer for Alabama. Dr. Harris, welcome.
Thank you very much. Good to be with you.
The month of July has been surprising in a lot of ways because we've seen cases increase instead of decrease. I mean, all told, July thus far has been the worst month for the spread of COVID-19. We've had more infections. We've had the daily numbers have peaked over anything we saw previously. And, you know, it just seems like we've talked before, we're going in the wrong direction. But given your position as a state health officer, you have a broad view of all this. Why do you think the numbers are climbing rather than getting better?
I think it's hard to put your finger on one single reason, but if you were going to pick one reason, it ultimately just comes down to people's behavior. I mean, we don't have a lot of tools in the toolkit to stop the spread of this disease, but the ones we have involve people staying 6 feet apart, people wearing face coverings, people staying home when they're sick. You know, they're all things that we're counting on the public to do. They're not really interventions that you know the state's able to force on people for the most part. And so we see people that are still having gatherings. You know, we see people who are still getting together in groups. We see people who are going out and doing things that put themselves at risk. And unfortunately, you know, we also have situations where people feel like they need to work or they really do have to work, even though they might be sick or even though, you know, they're not sure if they could be infected or not. Maybe they don't have access to getting a test as easily as they would like. So there's a combination of things that some are within people's control, some maybe not so much, but it just comes down to human behavior.
And I don't know how you change that. I mean, we've had so many mixed messages dealing with this. I mean, the Republican Party has now basically canceled their convention. They will do a virtual type convention, and which makes sense given you just can't have these large gatherings. I mean, we talked to someone the other day who a group of their friends had gone on a vacation together, a getaway together, and out of some 10 people that went, 7 of them came back positive for COVID-19.
Wow.
Given the severity of what we're seeing and the growth of the disease spreading, is there any possibility that you and Governor Ivey might issue a new order that closes down bars, large gatherings, and in-house dining at restaurants? I mean, some states are having to do this.
Yeah, I obviously I can't speak for what she wants to do, but we certainly try to give her the best information we can about what we think works and doesn't work. I think you're probably aware that last week we had a visit from Dr. Debbie Burks, who's the chairperson of the President's Coronavirus Task Force. You know, really the message that she brought us was that face coverings are really important, and you know, to Governor Ivey's credit, she had already put that mandate in place. But also, she talked a lot about bars and about gatherings as well. And so, I think there is evidence now from Arizona, for example, that taking steps such as just limiting the amount of time people spend in bars can have a real effect. You know, it's not that we're trying to pick on bars, you know, it's just that that's a situation where it's impossible to wear a mask. It's really hard to be distant from people because that's not why you go to a bar in the first place. You know, you're eating and drinking, you know, obviously, and many times you're in an environment where you may have to talk loud, if you're having to talk over music. It's just kind of a perfect storm. And on top of that, people stay there for a long time. They stay indoors for a long time in many cases. So everything you can come up with that would make it easy to transmit the virus, you can kind of find in a bar situation. So I would say nobody's excited about the prospect of trying to shut down businesses. Alabama has been through that like the rest of the country. But at the same time, that we would like to find a way to encourage people to have safe behavior so that we don't keep seeing these numbers go up.
Well, we talked about that the cost of shutting down the economy. But when you look at hospitals having, over the state, having hundreds of people in those hospitals, sometimes for weeks, there's a real cost to that too. I don't know how much it costs to treat one COVID-19 patient for a month or 2 months, but it has to be really high.
Absolutely. That's a great point. And I know that the people whose direct livelihood was affected, obviously, we certainly understand their perspective. They want to make a living. We get that. But you're making a great point. You also have economic problems when you have a lot of people who are sick and can't work. Yeah. When you have a lot of people consuming your hospital resources. Over the past week, just about every day, we've set new highs for the number of people hospitalized in the state. And I know that was true as recently as yesterday. I haven't seen today's numbers yet. But you're exactly right. And we need to find a way to balance that so that people can still have the ability to pay their own bills. We understand that that's really important. Sure. But at the same time, we need more recognition of the fact that more disease is bad for everyone. It's bad for every aspect of Alabama.
Right. And as we've seen, as we've gone out on limited occasions, there are places where you go and everybody's following the rules. Everybody's doing what they're supposed to do. And then you go other places and it's like nobody's doing any of the things that we're told that will keep you safe. Right, Susan?
Right.
It's just,
it's either all masks or no masks.
Yeah, it seems like that. And we've got about 30 seconds here. If there's one thing you feel you need to tell our viewers, what would it be?
Please do the right thing. Follow these rules we put out there because of the way it affects the people around you. Staying home if you're sick, wearing a face covering yourself, washing your hands, staying 6 feet away from people. It's how you protect other people. We hear these people who worry about their liberties and what we're ordering them to do. We're not trying to order you to do anything. We're asking you to please take care of the people around you, which is probably going to be mostly the people you care about.
Right. And if people don't like masks, they'll hate ventilators, right?
Yeah, that's right. That's right. Yeah. Public health shouldn't be partisan. I don't know how we got to this point.
I don't either. But Dr. Harris, thank you for all the hard work you and your team are doing. We hear great things out of Montgomery. And do come back soon and stay safe.
Thank you for having me. Look forward to seeing you again.
All right.
Good to see you.
Our special guest today has been Dr. Scott Harris, Public Health Officer for Alabama. You're watching The V. We'll be right back.
The Port of Mobile is a crucial commerce center for the entire state of Alabama.
Activities with our shippers generated over $490 million in tax revenue for the state. We've generated 135,000 jobs by having a competitive seaport within cost-effective reach.
Thanks to the state's leadership, Alabama's only seaport is being modernized to ensure that we are continually competing on a global scale. For more information, contact the Alabama State Port Authority at asdd.com.
A lot can change in 5 years. Except those smile lines you treated with Bellafill. Because that's about how long Bellafill will keep them smooth and filled. 5 years. Now you can always look your best without all those injections, appointments, and costs. Bellafill is the only dermal filler that stimulates and maintains collagen growth long term. Now time is on your side.
man. What are you doing today?
Play the game. Thought I'd go out for a drive later, maybe. Text some friends while I'm doing it. Scroll through social media. Kill a family 4 and a head on collision.
Cool, man.
Drive safe, Alabama. A message from your Alabama Department of Transportation.
Welcome back to the voice of Alabama politics. Susan, the State Board of Education has put out sort of these guidelines for school reopenings. I mean, you heard Dr. Harris say that the cases are mounting, people are getting sick, more people are dying, but we have a school opening plan that basically is going to throw $170 million at it and not actually have a plan.
There is no plan.
No,
There is
really.
no plan. I've been through all the data. I've been through all the proposed plans. I've been through all of it. What they have released to the schools is basically, you're on your own.
Yeah, you're on your
You're
own.
on your own.
You're on
Here you go. We want you to tell us what we're gonna give you money. You're gonna tell us what you're gonna do with the money. Other than that, you're on your own.
Yeah. This has been a problem with this pandemic from the beginning. From the beginning, the federal government said states are on their own. And this takes a concerted effort of a group of individuals who have a plan, and you can give me the one size doesn't fit all. Well, in this case, the disease fits all. More children, more young people are getting this disease.
And carrying it home to their parents
Right,
and grandparents
right,
and aunts and
right.
uncles. And, you know, and I have to say there are at least 8 schools in Alabama at this point that are saying, okay, we're going to keep the students home for
Right,
the first 9
right.
weeks. That's the first plan I've heard so far. But it's being done at the local level. It's
Right.
not coming from any kind of leadership at the Board of Education.
Right. Well, it's like they've just abdicated their responsibility.
Yeah,
for the most part.
absolutely did.
And the reason is, I think, is because they're elected and they don't want to make anybody mad.
They don't mind letting people die, I suppose.
Evidently not. I mean, that's terrible, right? But Montgomery County Public Schools, Birmingham City Schools, Tuscaloosa Schools, Mobile, Madison County, Madison City, Huntsville City, Anniston, and a few others, they are waiting 9 weeks just to see where they're at.
Right. They're going to do virtual.
Right.
But
Virtual.
they're going to wait to see.
But what we're not waiting to see is whether we're going to play high school football. The Alabama
How
High
ridiculous
School
is this?
Athletic Association has set out guidelines for restarting football. Football will start sometime in August.
It will.
And
it will.
we're going to have people staying at home away from school because they might get it, but they can go out on the gridiron and play football.
They
and watch
can
football.
get all tangled up and spit on each other and breathe on each other without a face mask and tumble and, run to the little the end zone and all of that. That's not spreading germs. There's no possibility of that there.
Well, what about
There's a golden dome over football in Alabama.
Well, there should be. Of course, there should be. But it just seems irresponsible to me.
You think?
Well, yeah, I do think, because these are young, healthy individuals, of course, but we are learning that, one, they can take it home. They can be asymptomatic and take it home. The other thing is that you're going to have people in the stands. You're going to have people socializing. I mean, one of the reasons I believe that we've seen spike in cases is because people went out on July 4th and acted like fools.
That same thing happened with the last holiday. Now, let's not forget, here's another point that I want to get in here. We're not talking about, scrimmaging against each other in the same community. We're talking about bringing teams in from other parts, other hot spots, along with their fans, and mixing COVID all together from all different parts of the state.
Well, Susan, they are not going to shake hands before the game or after.
That ought to do it right there.
They're going to social distance on the sideline.
On the sidelines,
Yeah,
how do you do that when you're in the lineup when
and nobody,
somebody got the little ball there and nobody spit on the ball or touched it or breathed on it or
you really got to think about spitting on the ball. Do you think they do a lot of spitting on the ball?
Have you ever seen a football game?
I have, but I didn't notice.
They usually
spitting
spit on each other anyway.
Well, they do that. Anyway, it's just kind of, It's just
insane.
Yeah, that's another
Irresponsible, insane,
well,
outrageous.
And only.
I love football. I do love football, but I think this is just so irresponsible.
Yeah, it seems like it. But we have a plan to play football. We do not have a plan to open schools.
No, we don't.
One of the things that happened this week, there's been a lot of lawsuits and various gnashing of teeth and wailing and sitting in sackcloth and ashes, to get biblical. But people are wanting more access to voting. They want curbside voting. They want mail-in ballot votings. Now, what Alabama has done is done through a wink and a nod. It says if you want to vote absentee, you can just check on there that you're infirm or in bad health,
right,
and you can't go. Now that's kind of cheating because,
well, yeah.
I don't want to go to the polls, but neither one of us are yet infirm, unless you would consider our mental state at times. But the thing is, that they've sued over our voter ID because one of the things is you have to produce a state voter ID, and the 11th Circuit surprisingly found that our voter ID law is constitutional. I say that facetiously. I mean, of course they were going to find that. It says it does not violate the 14th or 15th Amendment, and it doesn't violate people's civil rights. Now, the thing is, and I've said this before and I'll say it again, the easiest thing that any citizen of the United States should ever do is vote, because we have a form of government that is based on the fact that we decide.
Right.
We decide who is going to represent us in the government. And when you make it tougher for people to vote, fewer people are making the decision to who is going to lead. There is no substantial evidence of voter fraud.
With voter ID in the history of Alabama.
Yeah, it really, that we know of.
That we know of.
I mean, it is just absolutely ridiculous. I mean, we're trying to make voting harder when we should be trying to make it easier. Mm-hmm. Now, John Merrill, Secretary of State John Merrill, takes a lot of grief on this.
He does.
But he is upholding the laws that the legislature put in place.
Right.
That's his job.
Exactly.
I think the people that complain about John Merrill should probably look to Kansas and see what Chris Kobosh did, if that's how you pronounce his name. But this guy was like a Nazi. Well, maybe not Nazi, because we don't like to compare people to Nazis. Maybe he was a fascist. Anyway, we're going to have to hold it right there.
Yep.
You've been watching the voice of Alabama politics. You watch us, because we watch them.